I have Connie Dills here, who is a respiratory therapist, and she's been very active. You can tell them maybe she was the president of CT, the Connecticut RC, and she'll go into depth of that. But she's also from Hospital of Special Care, and this hospital is very unique. It's different than any of our other hospitals in Connecticut. Specifically when it relates to pulmonary. And I'm going to let her tell a little bit because this resource is just really important. And most of the hospitals in Connecticut, such as Yale and other hospitals, actually refer to Hospital for Special Care. So it's not a competitive thing. It's actually a resource and a tool for the other hospitals in Connecticut. So I'm going to have her talk a little bit about their resources and what you have.
Hi there. All right, can you hear me okay back there? We are a little bit unique. We're considered a long-term acute care facility, so unlike an acute care facility. Some of you may or may not know that the hospitals get penalized if patients are readmitted to with COPD to an acute care facility. Kind of how we work it, you may be referred to our facility for outpatient pulmonary rehab. Can kind of start in the continuum at any point. So you may go through our outpatient pulmonary rehab program, be followed in our outpatient pulmonary clinic, continue on in our exercise program. We have a very active exercise program, post-program. And we also have a very large pulmonary support group that meets monthly. It's a very robust group of people. They do a lot of activities together, and not only at the hospital, but they take trips and that sort of thing. The unique thing is that you can continue to work out there, exercise, and you're kind of in the gym there with the rest of the staff, respiratory therapists and nurses and other people that work at the hospital. And it's kind of a no judgment zone, so it's a very comfortable place. You don't have to be too conscious about the fact that you're wearing oxygen or you're coughing or anything like that. And then, sometimes we may see, oh, well, you're coughing a little bit more today, or you seem a little bit more short of breath. Maybe we should, have the doctor look at you. So sometimes that occurs, and we may end up being able to take care of you on an inpatient basis until we get you tuned back up, and then back out into the community again. The other thing, we do get referrals from acute care. So, you may be discharged from a hospital, or you may be in the emergency room at an area hospital, and they may call us and say, I have Mr. Smith here, and he's having a COPD exacerbation, and we were wondering if perhaps we could send him over to you guys and you could take care of him for a few days. And so we get a lot of COPD admissions into our facility as an inpatient in that respect. And then, like I said, the continuum just continues. So it is a little bit more unique. We don't get penalized for this point for readmissions. And so we specialize in people with breathing difficulties. That's kind of our forte, and it's always been our forte for the past 75 years. So we love our pulmonary people. So.